warning a new definition of our new normal.
If back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen. If you want to get to pre-coronavirus, that might not ever happen in the sense of the fact that the threat is there.
As the nation faces a critical stretch in the battle against the coronavirus.
The next week and a half is going to be a big surge, the professionals tell us.
A new Inspector General watchdog report finds hospitals nationwide are facing shortages of critical medical gear. And many states are warning their hospitals will run out of personal protective equipment within days. Among them, hard-hit Michigan.
At all 3 health systems, there are less than 3 days until face shields run out, and less than 6 days until surgical gowns run out.
Illinois' governor echoing the dire situation, criticizing what he says is the Trump administration's rationing of resources.
When you compare our federal shipments to our burn rate, the product that we've received from the federal stockpile will last only a handful of days in this multi-month battle.
Meanwhile, many small business owners are struggling to obtain loans promised under the $2 trillion relief package, as both technical glitches and sheer demand have overwhelmed the Small Business Administration. The president signaling the initial $350 billion earmarked for the plan may not be enough.
We're going to have to probably add more money to this to save and to keep our small businesses going and to keep the employees of those small businesses working.
Also overnight, South Carolina reversing course, now telling its 5 million residents to stay at home or work with few exceptions. Still, 8 states remain without a full stay-at-home order. Dr. Anthony Fauci says he spoke with the governors of 2 of those states, Iowa and Nebraska, and he believes they have an acceptable equivalent. The president says it will be left up to the states for now.
They are doing what we're asking them to do without having to put the seal on it. But I will say, if I thought it was necessary, I'll do it in a heartbeat.
As most of the country enters another week of sheltering at home and social distancing, Dr. Deborah Birx is calling on Americans to take care of each other while acknowledging how tough the situation is for everyone, including her own family.
My grandchild of 10 months got a fever of 105 this weekend. I'm the doctor, and I couldn't get there. And that's just an illustration that I know you all are making sacrifices, and I guess I want everyone to take this seriously.
Meanwhile, the New York Times is this morning reporting that senior White House trade advisor Peter Navarro warned the White House of the situation with the coronavirus in late January. Peter Navarro writing on January 29th, quote, "The lack of immune protection or an existing cure or vaccine would leave Americans defenseless in the case of a full-blown coronavirus outbreak on U.S. soil. The lack of protection elevates the risk of the coronavirus evolving into a full-blown pandemic, imperiling the lives of millions of Americans." He wrote that again on January 29th at the time that the president was suggesting this was all a hoax.
This morning, some potential good news in hard-hit New York.
Again, would suggest a possible flattening of the curve.
Daily hospitalizations are down, so are ICU admissions and daily intubations. And though deaths are still rising, the increase has been stable for 2 days. Still, Governor Andrew Cuomo is warning New Yorkers not to let their guard down.
If we are plateauing at a very high level, and there's tremendous stress on the healthcare system.
President Trump has now agreed to allow the 1,000-bed floating hospital, the USNS Comfort, to treat COVID-19 patients. But overnight, a crew member was isolated after testing positive for the virus. The Navy says it will have no impact on the Comfort's mission. Meanwhile, there's another 2,500 beds at the Javits Convention Center, which has been converted into a massive hospital and is now open. And possibly another 200 more beds next week at St. John the Divine, the largest cathedral in America, which is working out logistics of opening its doors to the sick. All potential relief valves for doctors like Evelina Graber, who works at a COVID-19 unit at North Shore University Hospital and says all of her patients are seriously ill.
You can actually smell fear. You smell death.
PPE every day.
In Harlem, frustrated medical workers are demanding more protective equipment.
To have an N95 mask every day is nothing. That's like us begging for crumbs when we need dinner.
New York City accounts for nearly a quarter of the nation's surging death toll. A funeral home in Brooklyn says it's running out of body bags.
We're overwhelmed. My staff they're on wit's end.
As city officials urge New Yorkers to wear face coverings when going outside, the governor is furious that some are not properly social distancing, and he has doubled the fine from not doing so from $500 to $1,000.
Americans are being advised to avoid grocery stores in the coming days. So this morning we have some tips and tricks to help extend the shelf life of the groceries that you already have in your house. So joining us is Allison Roman, cookbook author of Nothing Fancy and Dining In. Hey, Allison, good morning.
Hi, good morning. How are you?
All right, let's break